Good day! Welcome to Week 8, PE 10, Quarter 1. For this week's objectives, you will identify the different types of sports injury and understand the injuries that may happen during sports and its management. Also, you will learn how to appreciate the risk management for sports injuries. Before that, let's go to the past. Direction: choose the letter of the correct answer. Get a clean sheet of paper and answer the following questions. You have 5 seconds to answer. Once done, you may submit your output to your MAPE teacher upon their instruction. Number 1. How many hours is the most ideal time for an individual to engage in doing online activities? Is it A, 8 hours, B, 6 hours, C, 4 hours, or D, 3 hours? If you answer letter D, 2 hours, then you are correct. Number 2. What strengthening exercise can help you in burning fat on sides or waist of your body? A. Push-up, B. Superman, C. Crunches, D. Side crunches. Let us see. If your answer is letter D, then you are correct. 3. What I stands for in fit principle? A. Integrated, B. Iron, C. Intensity, or D. Irregular. If you answer letter C, intensity, then you are correct. 4. Among the given choices, what is the most effective exercise that can improve the muscle in the butt area? A. Crunches, B. Side crunches, C. Squat, or D. Burpees. If you answer letter C, squat, then you are correct. 5. What is the best way to keep healthy if there is a pandemic? A. Stay at home, B. Accomplish paperwork, C. Go to gym, D. Do workout or exercise at home. If you answer letter D, do workout or exercise at home, then you are correct. Knowing the different strengthening exercises and fit principles, we are prone to injury. And one of it is sports injury. These are injuries that occurs when engaging in sports or exercise. Sports injuries can occur due to overtraining, lack of conditioning, and improper form of technique. Failing to warm up increases the risk of sports injury. There are different types of sports injury. First is sprain, or the overstretching or tearing of the ligaments that results in a sprain. Ligaments are pieces of tissues that connect two bones to one another in a joint. So here is example of a overstretched ligaments that resulted into a sprain. It can be a tear, inversion, or eversion. Next we have strains, or overstretching or tearing of muscles or tendons which result in strain. Tendons are thick fibrous cords or tissues that connect bone to muscle. Strains are commonly mistaken for sprains. So when we say strain, It is a tearing of the tendon string to the muscle. Third, we have knee injuries. Any injury that interferes with how the knee joint moves due to sports injury. It could range from an overstretch to a tear in a muscle or tissue in the knee. Next, we have swollen muscles. Swelling is a natural reaction to an injury. Swollen muscle may also be painful and weak. Try to observe the picture of swollen muscles in the left. There is a normal muscle and there is also a swollen muscle. Then we have the Achilles tendon rupture. The Achilles tendon is a thin, powerful tendon at the back of your ankle. During sports, this tendon can break or rupture. When it does, you may experience sudden, severe pain and difficulty of walking. Then we have fractures. Bone fractures, also known as broken bones. It can be transverse, stress, oblique displaced, gymstic, or comminuted. Versus dislocations. Sports injuries may dislocate a bone in your body. When that happens, a bone is forced out of its socket. This can be painful and lead to swelling and weakness. Lastly, we have rotator cuff injury. Four pieces of muscle work together to form the rotator cuff. The rotator cuff keeps your shoulder moving in all directions. A tear in any of these muscles can weaken the rotator cuff. Great! Now that you know the different types of sports injuries, you should also know what are the treatments for sports injuries. Sports injuries and treatment. For immediate action, we can do RICE, that stands for protection, rest, ice, compression, and elevation. Protection. Protect the affected area from further injury. For example, by using a support. Rest. Avoid exercise and reduce your daily physical activity. Using crutches or a walking stick may help if you can't put your weight on your ankle or knee. A sling may help if you're injured shoulder. Ice. Apply an ice pack to the affected area for 15 to 20 minutes every 2 to 3 hours. A bag of frozen peas or similar will work well. Wrap the ice in a towel so that it doesn't directly touch your skin and cause ice burn. C for compression. Use elastic compression bandages during the day to limit swelling. And E for elevation. Keep the injured body parts raised above the level of the heart whenever possible. This may also help reduce swelling. Remember, injuries may happen during sports or exercise. This is what we so-called risk. And to prevent this, we should learn how to manage sports injury. There are tips in managing risk management in sports injury. First, ensure coaches are appropriately accredited under the National Coaching Accreditation Scheme. Ensure also that the club organization has the people with first aid training on standby when events are occurring. Maintain playing facilities such as pitches, courts, indoor halls, etc. at a high level to reduce hazards. Creating an emergency management plan. Enforcing rules about wearing of personal safety equipment or protective equipment such as example, helmets for cricket games in sports where this is applicable. Should also implement rules and procedures for inclement weather. Using medical health surveys to screen new membership. checking sports equipment if it is in good working condition or working order where there is applicable. Lastly, matching participant teams in terms of body dimensions, age, and or level of skills. With that, I think you're ready to test yourself by answering your module PE Division Module Module 5 Week 5 Sports Injury and Division Module 6 Week 6 Risk Management and Sports Injury. For PE, you will only answer check your understanding and pause test. And for health, you answer pre-test and check your understanding. Once done, you may submit a screenshot of your answer to your MAPIT teacher. You may access our answer sheet in our MAPIT 10 school year 21 to 22. You can also get your study guide and performance tasks at this page. Just scroll the page and read back. Get your desired material needed. You may also visit our page for other learning materials and video every week for additional information. Pass your output via FB Messenger until Friday. We are hoping that the enough time given is a lot in doing the said simple activities. Keep updated and stay connected. God bless learners!